All right. So a society is judged, of course, as you know, by how it treats its most vulnerable. And by that standard, Canada is facing a stark reality. Earlier today, I spoke to a guy named Daryl Whitehead. Daryl Whitehead's father, John, died in that long-term care facility, the private one in Dorval, Quebec, where 31 people have also died. And Daryl told me his dad had not had anything to drink for 3 days. He was suffering horribly. And he said, this is not just about his father, John, who died. This is about the many Johns out there somewhere in long-term care facilities who are dying. These are not just statistics. These are people. So the federal government today announced that they're going to try to have new rules. But are these recommendations enough? Well, let's find out. The Seniors Minister Deb Schulte joins me now. Minister, first of all, I hope you and your family are well. Thank you so much for joining us. Can you outline exactly what the rules are?
So, Evan, thank you very much for having me on your show. And those stories are deeply concerning and tragic. And I just want to share with you that I have my mother-in-law in a long-term care facility and my father-in-law in a seniors residence. So, you know, we are very mindful of the stories that are coming out. And, you know, while some facilities and my in-laws are in good facilities and they're doing the right things to keep them safe, obviously these stories are very troubling. So, as you know, the Public Health Agency of Canada, under the guidance of Dr. Tam, have been working very hard with the colleagues across the country to put together guidelines to give a framework for long-term care facilities and homes, the guidance that they need to be able to keep our seniors safe. So this is what the framework's all about. It's to be able to say, you know, we should have the staff coming in and out of those homes, and anybody coming into those homes right. should be properly protected properly protecting the residents and also protecting themselves with the personal protective equipment that they should need. They need proper training. There really should be controls on how many facilities people work at, because we understand that this now is one of the issues.
These are hot zones. Look, and it's easy to blame the staff. You can't. I mean, a lot of these staff are making $13 an hour. They don't have the proper personal protective equipment. They're going into a place that is a hot zone of COVID, and they're not protected. Your government, now I appreciate healthcare as a provincial territorial responsibility, but are recommendations from the federal government strong enough to actually make sure that our most vulnerable aren't suffering and dying in long-term care facilities?
First, I want to make a correction, Evan. There is no intent on my comments to imply that the health workers in those facilities are responsible or are not doing the very best under difficult circumstances. So I just want to start with that. The guidelines are there to support the provinces and territories in their jurisdiction, as you indicated, with the long-term care facilities. And I can assure you that my provincial counterparts are seized with this issue. And you can hear already earlier on the show, you talked about BC, and they already implemented quite a while ago some very strict measures which have seen good results. You see Quebec, you see Ontario starting to implement these guidelines. So this is a good indication.
That's my point. Are guidelines enough? Like guidelines, my question is, do we need something more formal than just guidelines, standards that people, I mean, the guy that I spoke to is paying $5,300 a month to take care of his father, who died basically suffering dehydration. I mean, it was, I don't even know how to describe it. It was horrific for him. Do we need something more than, quote, guidelines?
There's no question that those circumstances need to be investigated, and I believe they are being investigated where they've occurred. The guidelines, it is giving information to long-term care on how they should be operating to ensure safety of staff and safety of the residents. You know, this is what was needed. What should we be doing? How should we do it? So the guidelines are there. The jurisdiction of the provinces and territories is to implement these guidelines so that they can keep residents safe. So this is really what's needed, was what is it that we need to do? And now the provinces and territories are seized with implementing and making sure that they get the safe implementation.
Minister, but is this a sign that provinces and, frankly, the federal government, we've allowed this invisible tragedy to happen? My father-in-law was in one of these places. Some are good, some are not good. Have we failed our elderly?
I think what this crisis has revealed is where there are some weaknesses in the system that I am sure once we get through this, there will be changes brought forward so that we can have a better system in supporting our seniors. There's no doubt that this has revealed opportunities for improvement.
Well, that's mild. To be candid, that's pretty mild. Opportunities for improvement. We got 31 people dead at one facility, 18 at another. And this is more than that. This is a nightmare. And as someone said to me on Question Period on Sunday, if this was 18 college kids or 31 college kids, there'd be marches in the streets. Let me ask you this. What about a rule to make sure every person who works at a long-term care facility gets tested? Testing is key. Why isn't the federal or provincial governments making sure every single person there has got a test?
What you have to recognize, Evan, is that it is not, we didn't have a playbook on, once this virus shows up, this is what you need to do. We didn't have one. So we have now created a really strong set of guidelines that are going to indicate, and as you've just said, when people are brought into the facility, transferred from somewhere else, test them, because not everybody is presenting symptoms as we thought in the early days. Here's what you can be looking for. And
right.
When people
Minister,
don't have those symptoms, yeah, go ahead.
Minister, I got to be candid with you. We did have a pandemic playbook. 2006, Dr. Theresa Tam co-wrote it. It's there. I guess my question is, were seniors not part of that? In the pandemic playbook of 2006, that's been widely publicized now, I guess either the government didn't read it or seniors and long-term care facilities weren't included. Which was it?
That's not my understanding. My understanding is that this disease, this coronavirus, has manifested differently than the SARS epidemic or H1N1. There's lessons learned there, and those have been applied to these guidelines. But this virus is sneaky. It's been operating differently. It's been presenting differently and different symptoms. So there was no playbook on how to deal with this disease in a proper way. So we now have those guidelines, and they need to be implemented.
Right. But Minister, I just want a last question, because I think this is really important. I agree that H1N1 is different than Ebola, different than SARS. I understand that. But a pandemic playbook actually is supposed to deal with new viruses, new pandemics that come. Let me just press you again. Are you saying that the government, there was no plan for any pandemic for long-term care and for seniors who are vulnerable to these pandemics? There's nothing there? Because as we understand, there was.
No, that's not what I'm saying. I'm saying there were guidelines on how to deal with infection prevention controls and how to do that effectively in long-term care. So there have been guidelines on what should be done if an infection arises. We have that in place when people get the flu. They get, that flu that we get every year. When those come into a long-term care facility or they come into a senior's residence, they're catastrophic. So obviously there are guidelines in place, but this particular virus is not presented itself the same way that a flu would. And so there was protocol that needed to be developed based on the evidence of how this particular virus is operating and presenting itself. And that's what we've provided to Canadians and to long-term care facilities. Thank you.
Last question, Minister. How quickly will every single person who works at a long-term care facility be able to get tested? Every person that works there. Doug Ford talked about that. It's not happening. How quickly can you assure people everyone who works there or visits will have a test?
So the situation is, as you've heard Doug Ford say, he is seized with this because there's obviously shortcomings there, and so he is on the case of making sure that everybody gets tested. Every province and territory is at a different stage in this virus. We have now brought down these guidelines, and they are to be implemented. And this is going to be what's happening over the next little while. So I can't tell you when. But stay tuned. I think all provinces, as I've said, and territories are very seized with these guidelines and how to implement them to keep their seniors safe. Thank you.
Minister, I really do appreciate your time on a very busy day, and I know you're seized with this. Thank you so much. I appreciate that. That's your Senior Minister, Deb Schulte. Now, look.